So, today our topic is middle and posterior cranial fossa, division of the cranial cavity. First, we have the review. So we have you, and in this we have this is the frontal part, this is the middle, and this is the posterior part. So in front we have this frontal crest, frontal bone. This is the parietal bone, and this is the occipital bone. Cannot see the temporal because it's on their side. So we have sutures. Uh, this is the bregma. This is lambda. This is lambdoid sutures. This is sagittal sutures. Okay. Floor of the anterior cranial fossa. This is the front part. This is the front part. This one. Okay, so if we zoom it, we can see we have foramen secant over here. We have beside posteriorly, we have foramina of piriform pellet. Then we have frontal crest. This is crista villi, and this is the orbital part of frontal piriform plate. This is the lesser wing, anterior clinoid process, middle cranial fossa. Okay, so this middle part is the middle cranial fossa, as the name says. So boundaries we have anteriorly, the anterior edge of the chiasmatic surface, anteriorly this chiasmatic surface, which is a smooth groove stretching between the optic canals across the body of the sphenoid. And posteriorly, the anterior surface as high as superior border. Of the buttress part of the temporal bone. So this is the one. Floor of middle cranial fossa. The floor in the middle of the middle cranial fossa is elevated and formed by the body of the sphenoid. Lateral to this are large depressions formed on either side by the greater wing of the sphenoid and the smallest part of the temporal bone. Sphenoid over sphenoid bone. On the body of the sphenoid, the sella tertica, which consists of a deep central area, the hypophyseal fossa containing the pituitary gland, and the tuberculum sella. Horn of the saddle is vertical elevation of bone. It forms the anterior wall of the sella tertica and the posterior aspect of the chiasmatic surface. The middle clinoid process, lateral projection. The middle clinoid process is the lateral projections from the corner of the tuberculum. So this is the tuberculum sella. This is chiasmatic surface. Middle clinoid process, optic canal, foramen rotundum, foramen ovale, foramen spinosum. This is the greater wing. Okay. And this is dorsum sella. Posterior clinoid process. This is middle crinoid process, and this is posterior clinoid process. The posterior wall of the sella tertica is the dorsal sella, a large ridge of the bone projecting upward and forward. As I mentioned, this is dorsum sella. At the top of this bony ridge, the lateral edge contains rounded projection, the posterior clinoid process. Lateral to each side of the body of the sphenoid, the floor is formed on either side by the greater wing of sphenoid. Temporal bone, the posterior boundary of the middle cranial fossa is formed by the anterior surface of the buttress part of the petromestroid part of the temporal bone. Immediately, there is a slight depression in the anterior surface of the buttress part of the temporal bone. Groove and hiatus for greater petrosal nerve, small area groove led to the trigeminal impression. Groove and hiatus for the lesser petrosal nerve is the anterior lateral to the groove of greater petrosal nerve. The arcuate eminence around is the protrusion of bone and superior edge of the ventral part of temporal bone, just anterior and lateral to the arcuate eminence. The anterior surface of the petrous part of the temporal bone is slightly depressed. This region is the tegmental vein. Fissures and foraminals. In middle cranial fossa, we have superior orbital fissure, foramen rotundum, foramen ovale, spinosum, carotid canal, and viscera. The superior orbital fissure separates the greater wing of the sphenoid from the lesser wing, and foramen rotundum posterior to the medial lateral, posterior to the medial end of the superior orbital fissure. So this is the formula as I have mentioned before as well. Okay, so we have superior orbital fissure. This is the superior orbital fissure and the structure passing through it are oculomotor nerve, which is third cranial nerve, trochlear nerve, ophthalmic division of the trigeminal nerve, abducens nerve, ophthalmic remains. Foramen rotundum. This is foramen rotundum. The structure passing through is the maxillary division of the trigeminal nerve. Foramen ovale. This is foramen ovale, and the structure passing through its mandibular division of the trigeminal nerve and mesopetrosal nerve. Foramen spinosum. This is the foramen spinosum, and the structure passing through it is middle meningeal artery, carotid canal, internal carotid arteries, carotid plexus of nerve. This is the carotid canal. Posterior cranial fossa. Anterior. This is the posterior cranial cavity fossa. Anteriorly in the midline, dorsum, sella, and clevis. Laterally, superior border of the laterally, both sides by the superior border of the petrous part of petromesstoid part of temporal bone. Posteriorly, this is posteriorly squamous part of the occipital bone. Laterally, petromesstoid part of temporal bone and small parts of parietal bones. Floor of posterior cranial cavity. Median, we have the median area and the lateral area. Median area, front, middle, and behind. Front, the dorsal and clevis, middle, the foramen magnum, and behind, squamous part of the occipital bone. Internal occipital crest, internal occipital protrusions, grooves for transverse sinuses, grooves for sigmoid sinus. The lateral area, another part of occipital bone, posterior part of petrous temporal bone, mastoid temporal bone. Grooves and foramina. Grooves for the inferior petrous sinus. Lateral to the clevis between the basilar part of the occipital bone and the petrous part of the temporal bone. The internal acoustic meatus. Oval foramen laterally across the upper half of the posterior surface of the petrous part of the temporal bone. Jugular foramen inferior to the internal acoustic meatus. Groove for sigmoid sinus lateral to jugular foramen, and the jugular tubercle medial to jugular foramen across the canal. So these are the grooves and foramen. This is jugular tubercle, internal acoustic meatus, jugular. This is jugular foramen, hypoglossal canal, foramen magnum. Okay, so foramen magnum contains end of brainstem, beginning of the spinal cord, vertebral artery, spinal nerve, processing nerve, and meninges. And internal acoustic meatus, we have facial nerve, vestibulocochlear nerve, labyrinthine artery. Jugular foramen contains glossopharyngeal nerve, vagus nerve, accessory nerve, inferior petrosal sinus, sigmoid sinus, and hypoglossal nerve. Hypoglossal canal contains hypoglossal nerve, meningeal branch of the ascending pharyngeal artery. That's it.